Dry eyes absolutely impact people that wear an artificial eye. We have our standard information that we think of when we think of dry eyes. You know, we want to blink more. Are you having too much screen time, diet changes, other weird autoimmune conditions? But all of that kind of goes out the window as soon as we put a hunk of plastic in there and then expect the lid to blink over it all the time. So typically when it comes to determining if someone has dry eye that we need to go at a little bit more aggressively is once we get a prosthesis completed, we like to just see what their baseline of tears is before we start adding something in there. You know, common symptoms of dry eye, the burning, itching, stinging, foreign body sensation, all of those still apply. More so to the upper eyelid. And that's where all of our sensation of dry eye is going to come from for our patients because there's no cornea to give any of the stimulation to the rest of that structure there. So it's all about the upper eyelid. So when we have a patient come in for a check and polish, one of the things that we'll check for, we'll take the eye out, get it cleaning. And then when we look in the socket, we want to make sure that the implant's always covered or the globe's nice and calm. And then we'll evert the eyelids and see just how red and irritated those margins are. And more times than not, I would say in a scale of like 1 to 10 of redness, you know, 1 being that kind of peachy coral, 10 being almost bleeding, they're always kind of in that 4 to 5 range where things are just on the inflamed side, which means we're probably getting some meibomian gland reduction. You know, that little gland at the top is not allowing things to let that oil come out. So that's why we like the Retain so much, is it's such a great supplement to that lipid layer. And 9 times out of 10, that's what a prosthetic eye wearing patient is missing. So we'll start with that if we find that they're always burning, itchy, kind of a slow drag blink over that prosthesis, and then kind of go from there if we need to get them more aggressive with like the coconut oil and that sort of thing.